Namaskar. I, Dr. Charulata Bapai, welcome you all to the 299th episode of Gyan Pravah. It is a fantastic podcast series started by our dynamic president, Dr. Sunita Tandulwadkar. Madam, firstly, let me congratulate you on the highly successful Star Sampurna Presidential Conference by saying that आपकी मेहनत ने इस कॉन्फ्रेंस को मुकम्मल कर दिया। आपकी मेहनत ने इस कॉन्फ्रेंस को मुकम्मल कर दिया जो किसी ने सोचा भी न था वो आपने कर दिखाया। Heartiest congratulations, ma'am. Your energy, your dynamism, your intelligence, and your entire planning is indeed a treat to watch. I'm so happy to have been a part of your conference. Over to you, madam, to talk about Gyan Pravah.
Thank you, Charu. Thank you so much. And welcome, Dr. Raman. It's such a great pleasure and honor to have you on our Foxy platform. 299 episode is such a proud moment. And like Charu, I have 29 more chairperson. These 30 chairperson, the credit of this Pravaha goes only to this chairpersons of mine. Every day, 8 p.m., whoever is, I don't have to say anything. They prepare, they excel, they compete with their own podcast. And if they hear their first podcast and now 10th, 11th, I'm sure they will realize that they have evolved in the way they are taking the interviews, the way they are selecting the faculty. I think it's beautiful. And Charu, you are absolutely fantastic chairperson. I have it. Unfortunately, December conference, I was looking forward to that because you are really too good in organizing any events, conferences. You are dependable and you always have a beautiful creative ideas. I'm proud of you. And I'm sure wherever you wish to go ahead, you will definitely do best in that field. Dr. Raman, this academic, non-academic, global leaders, I thought I'm giving a platform to my chairperson so that they are evolving. They are our future leaders of our organization, and they should have this capacity, confidence, the way they will take this podcast 1 hour completely, the complete limelight on them. Believe me, more than them, I have evolved because I met 299 faculty. I heard them, I talked to them every day at 8 p.m. and I realized the world is so beautiful and there is so much more to do. We are just doing a tiny part of everything. When we hear the others, their success stories, their work, what they are doing, it's beautiful. It's beautiful. And I think this Pravaha podcast series, though 1 year ago we designed for the chairperson, I think it has evolved me as a person. It gave me a lot of growth, vision, and energy. My chairpersons, the discipline with which they work, that discipline also, I love them and I'm thankful to them. Now, today, after she introduces you, I'll go and join the viewers link, and you both will be here having the beautiful dialogue and will enjoy from the other link. Thank you so much once again, sir, and definitely looking
Thank you.
forward to see you sometimes in person.
Yeah.
So much,
Thank
madam,
you.
for those words. And your inspiration and your praise means a lot to all of us. Thank you for all those beautiful words. And now we come to our guest speaker for the day. He is India's foremost public health experts, none other than the Padma Shri awardee, Dr. Raman Gangakhedkar, sir. Sir, we welcome
Thank you.
you to this podcast. Dr. Raman Gangakhedkar is a Padma Shri award-winning epidemiologist and one of India's foremost public health experts. Currently, he is a distinguished professor at Symbiosis International, Pune, and formerly held the prestigious Dr. C.G. Pandit National Chair at the ICMR. As the head of the epidemiology and communicable diseases at ICMR, he played a a pivotal role in the major outbreaks of Nipah, Zika, and the much dreaded COVID 19. Sir, your guidance to the entire country was really commendable, and we are really proud to have you here for our podcast. His leadership and insights continue to shape national and global health policies with contributions to WHO's SAGO and several national task forces. I think he is recognized mainly for his work in HIV. I think he was one of the pioneers in doing so much work for HIV when nobody at all was in this field, which was a dreaded field at one time. And sir, your 240 scientific publications is something that we bow down to. You are genuinely a source of inspiration because we know how difficult it is to have even a few publications, and 240 is such a stupendous number that you have. We are really proud to have you here. Sir is also the recipient of numerous degrees and awards, the DLIT, Doctor of Medical Science, and Lifetime Achievement Awards from numerous organizations. Sir, your energy, your enthusiasm, and your academic pursuits definitely are going to enrich us today, especially as we move down and when we talk about so many different things.
Thank you. Thank you, sir, once again. And thank you for giving your valuable time to Foxy. Thank you.
I should thank Fogsi, Dr. Tandulwadkar, Madam, and Dr. Bape for inviting me to this prestigious event.
Sir, you are humble. You are too humble to say, but we are really grateful to you for giving your, and that to Sunday, Sunday evening, taking out time other than the family is equally important, sir. Thank you so much. Thank you. I listen to both of you from the other side.
Thank
Thank
you.
you.
Bye. Thank you. So, Raman sir, we turn over to you now. And I remember that as I grew up through MBBS and internship, um, epidemiology, PSM, public health, all this was kind of either put for option or we just wanted to pass through. And most of our interest probably or our aim was to do well in medicine or surgery or gynecology. And so we just would like to know that how did you turn to public health?
Honestly speaking, by education, I was a pediatrician. And before I started my career,
Okay.
and then I moved to National Institute of Nutrition, which was one of those top three research institutions in the world at that time.
Okay.
And from there, I came to Institute of Immunohematology, where I started working on sickle cell disease. And suddenly, I stumbled upon a case of HIV disease. Those days, it used to be called as AIDS case. No, this is story of 1989,
Yes, sir.
and I decided that I would perhaps pursue the course of HIV/AIDS at that time, because there were hardly three people in Bombay in those days who were willing to touch those patients, speak with those patients. There was so much of scare that one may acquire HIV infection out of these exposures that could occur. And I thought that we should, no, somebody has to say, no, I will start seeing it. There used to be different kinds of excuses people used to give. So mine was an entry uh, through a different kind of things. And then when I shifted to Pune, where National AIDS Research Institute was established,
Okay.
my director general, he said that I want you to be trained in public health. No?
Oh,
So he sent me to Johns Hopkins University, which is world number one. Those days also it was world number one institution to teach public health. There were giants in the field there. So I did masters in public health there, and that's how I entered into a new era. Though by every day I used to be a clinician, managing patients in one of those clinics that National AIDS Research Institute had, which used to be called as Gadikhana,
hmm.
adjacent to red light area.
Yes.
Uh, so I just ended
Yes.
up.
It is a rather convoluted journey like a river. You started off as an academician with doing pediatrics, then you moved to nutrition, and then to AIDS, and then came in public health. So I think, sir, we all realize that, that as we move ahead and as we roll ahead, we gather something from each and everything that we learn or each and everything that we do. And that is probably what has made you such a well rounded personality. And all the knowledge that you've gathered from everywhere has helped you reach where you have reached. And your work for the society is really commendable. And so I think, I remember distinctly that AIDS, it was such a fearful word once upon a time, and I'm sure nobody at all really must have wanted to work in that field. And that word itself had such a big stigma to it. So to jump into such a field and to work in it for the last 3 decades or more probably is so commendable, Dr. Gangakhedkar. We really want to hear a little bit about your journey in this particular field of work.
Actually, that entire credit related to reduction of fear actually goes to the first patient's wife,
Acha?
whom I had seen in Valsad district. That was, I was also there. Also, I was accidentally asked to see the patient by one of my other colleagues, who has got Padma Shri, Dr. Italia, very recently on sickle cell disease.
Okay.
So he asked me to go and see the patient who was ostracized in one of those villages.
Right.
And there I was as much scared because I didn't know. My knees were shaking
Oh,
while I was dealing with the patient. And then suddenly his wife came and she came with a cup of tea. While when I looked at her, she was smiling. And then I said, I'm a fool. No, this lady doesn't know anything about HIV. This lady actually lives in the same bedroom, in the same house. I don't know whether she has a sexual relationship with her husband, but she can smile, she can take care of herself. Then I should be ashamed of my medical background, no? And my shaking stopped and I moved into it. Then the stigma related aspect started hitting when I first went to Kamatipura. I
okay.
realized that there is so much of social inequity. No, we don't treat those who are sex workers, those who are men having sex with men, hijras. This population, whenever we used to look at them, they were less than human beings, and that's something which I hated. I said this is not the way to deal with them. Even they have life. I have to handle them. It actually meant that people used to think even otherwise that he is a AIDS doctor, no. So
Oh,
for us, not many social interactions were possible in the earlier era, but it was a small community of motivated doctors in the profession who could make a difference. And today I'm very proud to say that it is the only chronic persistent viral infection which we have almost controlled as of now, minus vaccine. No, anything that you control generally has vaccine,
yes,
but we have made a tremendous impact on this. And today, the patients can aspire to have a full normal life with antiretroviral therapy. It's something which is an amazing journey.
I fully agree. But even at that time, to go to Kamatipura, the red light area, and to work over there must have been, a different experience. And not many people must have been doing it. So hats off to you, sir, for all those, bold steps. Because डर के आगे जीत है is what we always say. And at that young age, I mean, obviously all of us are little less experienced. The fear is there, but you overcame it all and see where India has landed up in such a positive situation as far as AIDS HIV is concerned. But there is one question as a Foxian which I would want to ask you, sir. As a gynecologist, we always worry about the mother to child transmission of this HIV infection. So, whether to breastfeed or not, does breastfeeding also increase the risk of HIV transmission? All these are questions which keep coming to our mind. Yes, we do have some guidelines regarding all this, but I really want to take your opinion and your thought process regarding this mother to child transmission of the virus and what can be done for it.
Yeah. Actually, mother to child transmission of HIV infection is very close to my heart.
Okay.
When I came back from Hopkins after completing MPH in 1996, if I recall correctly, I decided my collaborator actually wanted to see that I work uh, on their projects, which I said I won't. I came back, and then I said the first area which you need to handle is mother to child transmission, because I had already forayed into, those days people used to call those who are infected as sinners, no?
Oh,
And that I had used one of my papers which was on the risk of transmission of HIV infection to married monogamous women, which was published in JAMA. And that made a big difference, because suddenly those who were viewing the whole thing used to feel, if women who were not in quotes, I would say, promiscuous, they never had more than one partner, but
right.
still they were acquiring HIV infection in
Oh,
Pune.
God.
And that was, the incidence was close to 14% at that juncture.
Very
So I had destigmatized. People had, started thinking of HIV. These women should be protected, and that was used by UNAIDS across in Southeast Asia for advocacy purposes. Now, what happened was, then I decided you must work on pregnant women. Only then people's outlook, those who are policymakers, can change. So I came back and I wrote a proposal on use of ritonavir, which was a new antiretroviral, to reduce mother to child transmission, because at that time in 94, zidovudine was proposed to be used as
yes.
one of the drugs, that can reduce mother to child transmission. And when I came back here, nobody wanted to provide funds for a new drug trial, no, because there was a scare that if something goes wrong, it's a pregnant woman, so
Oh,
everything will stop. So
oh,
they asked me to conduct a feasibility trial
uh-huh.
based on zidovudine only. So I did that zidovudine trial. Uh, it was called as feasibility study. I established 11 centers of excellence across in India,
My goodness.
and we conducted the same. Then we subsequently we went for nevirapine, which was a single dose regimen, and at that time also, even breastfeeding related issues used to come. But the reality was, if you look at it, no, even at the time of nevirapine, we knew that the concentration of nevirapine in the breast milk is so high that the child may not acquire HIV through breast milk as such.
Right.
And that started moving in that direction. And when we started this national program sometime in 2002. And later, we shifted to a regimen which was three drug regimen, which was aligned with the regimen that we use to manage adults with antiretroviral therapy. And when we did that, at that time, there was strong evidence that you don't need to worry at all. No, basically because the drugs are so powerful that the concentration of, or the levels of the virus in the blood, in body fluids, including breast milk, has become almost undetectable, and therefore you don't need to worry about transmission through breast milk. And the reality of life is, we hardly ever saw a case which was a proven case of transmission through breast milk. So even today, what I would say, that please do not worry. It is the, if you use formula feed, the risk of death or morbidity continues to be higher with formula feeds compared to, what happens with the breast milk. So why stop that at any given point in time? Today we say that you continue this as long as possible, maybe up to, ideally up to the age of 6 months, exclusive breastfeeding if it is possible, and there is no reason to worry.
Sir, a big round of applause for this particular fantastic take home message, because, as the chairperson of the Breast and Puerperal Committee of Foxy, I think this message goes very loud and clear that the benefits of breastfeeding far exceed the risk of transmission of HIV from the mother to the newborn infant. And that breastfeeding is probably the most important tool that we have today, which can prevent so many infections and so many problems in the newborn. That I think this is a point very well taken, sir. And thank you for that wonderful message from somebody
No,
who
no,
has
the only
work.
thing which I would stress for gynecologists is you have to ensure that the pregnant woman continues to adhere to her drugs.
Okay,
That role is immense for a gynecologist because she is going to come to you during ANC
right.
and you have to ensure that she adheres to it. If she adheres, there is absolutely a very, very rare kind of a risk of transmission, if at all.
So currently we see that they genuinely are so very particular about their medications and they do adhere. So what is your experience? Like what do you think? That I think most of these patients are very good with their medications. Am I right?
Yeah, that's right. See, initially we were all worried. See, we started on a backdrop where the government was never providing free treatment for any chronic disease
Okay.
at that time. Our per capita health expenditure was 30 rupees per person that
Right.
day. No, you will find that even ELISA test used to be considered very costly option because the cost was pretty high
Okay.
if you compare
Okay.
it per capita income. Now, when we started moving towards free antiretroviral therapy, one of the issues that everybody used to worry was whether these people will continue to take tablets on time and regularly, every day per se, because that was extremely important from HIV perspective.
True.
But what was also important was you look at that backdrop. If you even today, if you look at all of us, if you are to take, let's say, anything for diarrhea, let's say one BD schedule for 5 days. No, if the doctor prescribes like that, you will find that you will stop after 2 or 3 days and forget about taking it later. What would happen to these women? This population was an important issue. So what we did was we went for treatment literacy
Okay.
counseling among these HIV infected persons. And we gave them that hope that if you continue it like this, you will find that you will survive your entire life, and that threat or that fear that I might die would perhaps not be there. And we used to even teach them as to how do you time, because those days, even in the initial period, there were no mobiles.
Right.
People who could not have had bought mobiles,
Right.
but they had TVs. So how do you match your TV program and let it act as a cue to taking pills? And this particular education, along with the education about toxicities that can come due to drugs, how to manage those toxicities, are these important toxicities that can lead to morbidity, was discussed with these people. And therefore, today you find that they are very much convinced that if we take these medicines on time, they are absolutely comfortable and they're likely to live full life.
Wow.
That's how we handle adherence. And this is a lifelong treatment
Right.
which the people take.
So counseling, counseling, and only counseling. That is what probably is, the bottom line for the success of this entire program. And I think that it has been done so fantastically. So as we move on, we would want to talk a little bit about cervical health also. So CA cervix. CA cervix and HIV again, go hand in hand to some extent. So, did you have any experience in the field of cervical health, elimination of CS cervix from India? Because, today we are saying that by 2030 we want to eliminate CS cervix from India. So, is it a possibility? Is it a probability? What is your thought regarding that, sir?
Yeah, I had initially worked with Dr. Smita Joshi, who
Yes,
works on HPV. She was actually one of our colleagues, junior colleagues in Nari.
yes.
She used to focus more on HPV. We have few papers with her on HPV. She
Okay,
used to work on sex workers and
okay.
how sex workers' disease progression would occur.
Mhm.
So we had a fair bit of experience on the same issue. And we realized that if at all, these women, even if they survive, the risk to their life is going to be through CA cervix, which could occur little more faster among these women.
Okay.
Now, what do you do about it? So we started looking at how do we diagnose them earlier. So through HIV program, even in national program, VI was introduced through antiretroviral therapy
Oh,
centers, ART centers. And when VI, pap smear, everything, that algorithm was very well developed. The result was we were able to detect that earlier. And then came a concept which we were using, like in antiretroviral therapy. We used to say anybody who's found as positive, test and treat. If you see somebody who's infected, provide antiretroviral therapy immediately so that his life is not threatened by anything at all. The same approach was also used in HPV infections. In
okay.
HPV, anybody who had a cervical lesion
Right.
used colposcopy to take out that lesion. Only
Okay.
then the issue could be different. Those approaches were adopted. And
Oh,
yeah, there, even in the first guidelines for antiretroviral therapy, for us, we used to say yearly checkup through pap smear is mandatory
okay.
among them. So things have moved forward. There is absolutely no reason to worry. Unfortunately, we cannot move towards HPV vaccine because by the time we reach these women in sex work, you will find they are already exposed to HPV. But
Right.
we are sure that things will be better with the newer approaches to manage, CIN, that probable CIN that may be existent, and things would be fine. With the support of antiretroviral therapy, they are no longer immunocompromised hosts. So
Right.
the rapid progression may not occur. They
Wonderful.
become immunocompetent the moment you provide ART, and their CD4s or immune system is going to protect them for a longer period.
Well said, sir. I think that is a very positive and that's a very, ray of hope that today so much work is being done for the HIV positives, that their immunity is no longer going to be so low that their disease will progress into frank invasive CA cervix. So we can hope that the morbidity and mortality because of this disease will be limited and our women can lead a better, happier and healthier life thanks to all these progresses. And now we move on to that dreaded phase of 2018, 19, 20, wherein so many new diseases just swept into India. I mean, when we read about things like this Nipah virus, Zika virus, we used to wonder, is it even real? Like, and do they even exist? Because when we live in a small cocooned world in a small metro, we really don't know what is happening even outside our city, in the whole country, or in the outside world. So I think you were at the forefront for all these diseases, so we really would want to speak with you regarding these newer viruses, which are making an entry into the world, and how should we, react to them? How should we behave? Is there any chance of even newer mutants and newer viruses coming into the country or the world? I think you are the best expert for that, Dr. Raman.
Nipah, within first 5 months or 6 months, 5 months of joining headquarter at ICMR as head epidemiology and communicable diseases, there was a report that came from Kerala that suspected cases were picked up, and when we tested them through NIV, we found they had Nipah, which was unusual because it used to occur more often on Bangladesh border and West Bengal. No,
Okay,
and never ever it had occurred in Kerala. So we were little worried as to why this happened.
okay,
Then the next thing that happened was we realized that among the first few suspected cases, there was a person who was from army, who was admitted in Calcutta. So there was a fear that this could
oh,
be bioterrorism because it has a very high case fatality rate, which goes close to about 90% because it doesn't, it was extremely high. So Nipah gave us very short period of time. It was only 2 weeks episode where these bats were transmitting. We had to prove everything within 2 weeks comprehensively. And
Right.
not only that, we brought even monoclonal antibodies from Australia to manage that. And the result was, over a period of time, our comprehensive actions, including community involvement, community mobilization against Nipah, were so successful that next year, we had only one case and the case never died. You know, because
Oh, quite
our
successful.
interventions were strong enough in Kerala at that juncture. And we became number one globally. People used to be astounded that India could manage so much without seeking funds from anybody or help from anybody. We never knew that we never had the time to even look at that. Zika came the same way. No? And Zika, there was a particular problem that we did not know. We had only reports of imported cases coming from outside,
Okay.
who had traveled to Brazil and such areas from where they would acquire HIV, this Zika infection. And those cases were detected so far. And when it occurred in 2018, towards the end, somewhere around September, November, I don't remember. But at that juncture, the first thing which we did was we wanted to find out whether this disease is indigenous or is it a imported cases that we are looking at. So
Okay.
in Jaipur, the pregnant women's cohort, we kept a watch on it. We showed that these women harbored the same virus as the virus that you see in mosquitoes. So which
Oh,
essentially means Zika is also well established. And we launched comprehensive kind of researchable areas where efforts were needed through our own systems at that juncture. Uh, Fortunately for us, those outbreaks lasted for a short period of time. And now we know that episodes of Zika tend to occur. But at the same time, what is important to remember, our diagnostic tools fail to detect that earlier because there are no good symptoms. By the time you pick up such a case and diagnose, perhaps you are too late and you miss that infection altogether.
okay.
Zika is very much here. It's a mosquito-borne disease. And COVID, all of us know, no, we never ever thought that this would spread so much. No? But there was a time when the scare increased so much. When I reflect on what we did, is people used to still, people still criticize lockdowns and things that we had to do. But at the same time, they must realize that lockdown was also mandatory because we did not have adequate quantity of even hand wash related to this thing. We did not have reagents. We did not have gloves. We did not have sufficient quantity of PPEs available in the country. Neither even masks that you require to wear if you are to provide care. So how do you handle this situation? We
Right.
had to go for lockdown,
So
and
true.
lockdown
It
had,
worked, sir. It worked. It worked so well.
yeah, very much. And actually, we started exporting these whole things
Mm.
in India. And why does this become important? Because when you have a lockdown, even for industries, we have to ensure that there is a free movement for industries, workers. No, they should be
Yes.
able to move around when there is a lockdown and they can't go anywhere else. What perhaps people don't know is when you embark on a vaccine schedule and the vaccine has to be given to everybody in the country, you have to remember that even syringes and needles,
Yes.
their numbers were so small. How do we do that?
So right. So right.
That
So
was
that
used
also
dramatically.
yes.
Yeah.
Jesus.
So that was a unique thing. Now the question is, will newer diseases come? Yes, they will come. Mainly because of climate change, you will perhaps find that these would be essentially zoonotic diseases. Human and animals interface is going to get impacted because of the climate change that is occurring, and also rapid urbanization in areas where deforestation is occurring so much. You will find that these issues will become common. Now, one of the things which I feel, which could be the organism, no? One could be from the same lineage of bats. I still feel it may not be COVID, SARS-CoV-2, but it could be another one that comes from the bats. Bats continues to remain as an important agent for new kind of infections that could occur. And secondly, it could be antimicrobial resistance that could affect us.
Yes.
And the third is, in today's geopolitical scene, when you look at it, perhaps it could be some agent of bioterrorism, which any of these countries, when it comes to the worst survival issue, perhaps could be another threat that may lurk. And we have to be vigilant. So, One Health surveillance has already been intensified in the country,
Okay.
and therefore we should be mindful of the fact that even if something happens, we will be able to detect them earlier. The industries, the government has had a good experience, adequate experience in COVID as to how to respond. So our pandemic preparedness is at the next level. There is no reason to worry, but we need to keep a watch as to when such an infection would strike again.
Very well said, sir. Very well said. And I think that this preparedness is so very important, whether it's in the operation theater or whether it's at the community level or at the national level, which our government is, taking such major steps to make sure to control any new pandemic if it does occur. So that is a point very well taken. I just thought one more thing, just as I'm talking with you, sir, is that the pandemic went and all the masks got thrown into the dustbin. So, what is your thought? Do you think that being safe rather than sorry is a better idea? And there are some people definitely even today when they enter my OPD, they will be having their masks on, and I am not sure how I really respond to a masked person today. But is it a good idea to continue wearing a mask?
At least those who are infected today, let's say if I have a symptom, cough and cold and fever, at least I must wear a mask, if not anything else. If I'm an elderly above the age of 60 and I'm going in a crowded area where I do not know whether somebody could be infected, I must wear a mask. Now, what you asked is an interesting issue. It was very difficult to convince. It was a major challenge, as to how do we sensitize people. Even today, when I look back at HIV,
Hmm.
even today, if you ask people as to how HIV is transmitted, how it is not transmitted, only 60% of the people will perhaps give correct answers. The infection was so fast spreading, we
Yes.
had to ensure that the action happens, people are mobilized. So every day, we used to have 1.5 hours of press briefings where we used to approach the people, and those were so important to do. We tried to teach them, but some of them, when you do education through such a mass kind of an approach, you will find some of them do it out of fear. And when you do it out of fear, when you wear mask out of fear or acquire a new habit, you will always find that they will they will throw these masks away as that so-called perceived threat is not seen to them or not felt by them, so they return back. But the reality of life is all of us must be vigilant. We must use masks in different circumstances, especially even among doctors, those elderly doctors who go to the clinics and see their patients or in the hospital with the patients. It is good to avoid those getting those infections when the seasonality tends to affect you with a newer kind of a variant that comes. Current variants that are there are not going to bother us as much. But wearing a mask is always a good idea, because not only would it prevent respiratory infections, but it could also lead to your protection from pollutants that are around you. So it's a good habit to have.
Well said, sir, because the pollutants today can cause anything right from maybe hair loss, skin pigmentation to infertility. So I think that is again another point well taken, sir. And I think let us move ahead to your life journey, where you have been awarded so many different awards, so many lifetime achievement awards, and of course, the most revered Padma Shri Award. Sir, any particular experience, anything you want to share? Which award is probably the closest to your heart?
No, it is. See, Padma Shri, it was my lifetime principle that I would never apply for any award.
Okay.
Never ever I have applied. Now the issue was one day I got a phone call from my patients, no, patient group. No, they said we want to know your date of birth. I
Uh-huh.
was shocked. I said, क्या दिमाग खराब हो गया? मेरा date of birth आपको क्यों चाहिए? So that person said, sir, all of us, all associations in the country of those who were, people living with HIV infection, they had 14 lakh people who
Yes.
were part of their organization, the sex workers organizations, the MSM organizations, the Hijra organizations. All of us have agreed that we will apply for to the government that you should get the award. So
My God.
essentially, they had applied, not me. Now I never thought, that they had even those skills to write anything. No, you have to write it in English.
Yes, yes, yes.
I never even bothered. But, one of those days, on 25th of Jan, on 2020, COVID had just started at that time.
Yes.
And I was going to buy uh, a briefcase because I was to travel to Pune on in the coming week, and mine was broken. And my driver was there. We were going on the flyover, and suddenly a phone call came. And the phone call was he asked me. It was 011 number from an area which tells you that this is from the ministries. No, so I asked him to stop the car, and I spoke with that person. He said, I'm from Ministry of Home Affairs. I was extremely scared. I said, I don't know what wrong I have committed. No? So then he told me, Doctor Sahab, he was a joint secretary, so he said, मैं ऐसा ऐसा हूँ ना, आपको सरकार ने सोचा है आपको पद्मश्री अवार्ड देने वाले हैं, क्या आप लेंगे वो? अरे ये तो बहुत बड़ा शॉक, मुझे मालूम भी नहीं, मतलब कि मैं कभी एक्सपेक्ट नहीं किया था।
Right.
वो हुआ, लेकिन once, I told my wife then, no, I asked my driver to stay away from the vehicle. I
Uh-huh.
told my wife that I have received such a phone call. All of them were very happy because nobody expected that the community's request will ever be attended to, because we had a different kind of perspective for that. And then I told my wife, please don't tell anybody, not even our children, mainly because my scare was this a fake call? So that's how, I got the whole thing. But since you asked a question, what was the most closest to my heart? No, once I superannuated and I came back to Pune, all my sex workers, that population, key subpopulation or socially challenged population groups, they wanted to felicitate me.
Okay.
And when they felicitated, I told them two things. One, we'll wait for the COVID outbreak to go, at least reduce intensity, then we will have it. And then second, we should have minimum number of people. And I don't want anything coming from this population, which is always disadvantaged. They don't have even money.
I agree.
Sex worker came, one of those, among all these associations. She came, she gave me gulab ka phool, and she said their language is crude.
Yes.
So this lady says, इसको मालूम नहीं था, मैं पहली बार ये डॉक्टर के पास गई ना, तो उस दिन वो सोच के गई थी, क्योंकि रात को मुझे HIV पॉजिटिव है करके पता चला था, रेड लाइट एरिया में थी, और मैंने सोचा था कि मैं डॉक्टर के पास तो जाऊंगी क्योंकि सबने बोला इसके पास जाना तुम्हारे लिए जरूरी है।
Mm-hmm.
मैं गई। जाने के बाद मैंने जाते वक्त मैंने सोचा था उस आपसे बात करूंगी और बाद में रेल पटरी पे सो जाऊंगी।
अरे,
ये एक आदमी है जिसने वो होने नहीं दिया,
my
बीच
God.
में वो हिम्मत लाई। टू मी दोज वेर एक्सट्रीमली टचिंग, crude words, but so to me, community awards are
Yeah.
far more closer to one's heart.
So such a heart touching sentence that was, and that was just one lady who could say it out, but there must be millions out there who are waiting to thank you, sir, for all the amazing work that you have done for them. And these are path breaking work, sir, and it takes a lot of grit and gumption to travel the road which has not been taken by many. And so we would want to ask you, like, what is the philosophy, or what are those qualities or those ideas which made you tread this unwalked road, the road less traveled. And what would you want to advise our youngsters regarding public health service? And do you think that they are motivated enough to take this very tedious path today?
Ideally, one should. No. To me, one of the things which I always kept on telling that there are so many people who are born. No. There are so many doctors who may earn huge amount of money.
Right.
Will that make them very happy? Perhaps not. It is a transient sort of happiness that you witness episodically all through. But if you make difference in people's life, that will give you a satisfaction which nobody, no other thing can ever provide to you. Now the issue is what kind of satisfaction could you have? No, if you treat one patient, if you manage that patient and the patient becomes healthy again, that's one way to do it. But you have to look at making larger change, and that larger change can come through research based approaches where you change the policy through your evidences that you generate, and through your work millions of people who are infected or affected or whatever, their lives can be improved. So one issue which I feel is everybody has the capacity. They have to dream big to make difference in the society, and it can always happen. All of us have that ability to do it, but you need passion in that area. You will always make a difference. And finally, no, we should be taking pride in what we have done, and it can only happen through some things that you do to others and not to oneself by earning
वाह, वाह, वाह. आणि म्हणूनच आपल्या मराठीत म्हण आहे, सर, देणाऱ्याने देत राहावे, घेणाऱ्याने घेत राहावे, घेणाऱ्याने घेता घेता देणाऱ्याचे हातही घ्यावे. Like,
money.
we really wish that we can take this energy, this inspiration, this passion which you share for all these affected people, and the way you have relentlessly worked for them. I sincerely wish that all of us and our viewers also take this passion, this energy from you, and manage to do some small bit of good for the world at large. And maybe we can also leave a small footprint behind and feel that we have lived an accomplished life. Thank you so much, Dr. Raman
Thank
Gangakhedkar,
you.
sir, for this fantastic podcast with us. We are really privileged to have known you a little bit, heard you, and seen the big picture which you have painted, which has helped the HIV positive people and so many other community diseases that have been well looked after thanks to your guidance. Thank you,
Thank you.
support team of Gyan Pravaha, for all the help. And I wish everybody a good night. Thank you so much.
Thank you.
Thank you.